We've come a long way in the treatment of follicular lymphoma. The prognosis is improved. We understand how to risk stratify based not only on the baseline characteristics, but probably more importantly on the initial remission duration. We now have agents that are not traditional chemotherapy or chemo antibody therapy, but we still have work to do, especially for that 20% of patients who have that early relapse. We really need to improve outcomes for those who have the poor prognosis. So I'm very hopeful regarding some of the agents that are and classes of drugs that are on the horizon. One class of drugs are the T-cell engagers. These are often called bispecific antibodies that basically bring the lymphoma cell in proximity to the T-cell. They're often CD20 and CD3 bispecific is a common construct. And these have shown some early promise in follicular lymphoma, and we're hoping that this would be an off-the-shelf immunotherapy that could be potentially effective for patients, particularly those that have chemo-refractory disease. Taking it up a notch, something that's already approved for other B-cell malignancies are CAR T cells, chimeric antigen receptor modified T cells. I'm sure many of you are familiar with these, but there are studies that are ongoing or have been completed, and we're awaiting their results in terms of having this as an option, particularly for the highest risk and fit patients. This is something one has to be relatively fit to make it through this. This would be a relatively small subset of follicular lymphoma patients. Nevertheless, for those that really need another option, and there are some that could potentially benefit, and this is potentially a curative strategy. There are other number of small molecules, such as EZH2 inhibitors. We're hoping for that small subset of EZH2 mutated patients could benefit from agents such as tazemetostat. And there are a number of other novel compounds in the pipeline that we're looking forward to. So I'm very hopeful regarding where we're going with follicular lymphoma. We can say to the majority of patients that their lifespan should not be shortened with this diagnosis, and we can manage this as kind of a nuisance disease. But there are still some where this disease will shorten their lifespan, and I'm hopeful that our new approaches will improve their outcomes.